Pulse assessment is an essential part of recording vitals. Pulse is most commonly measured on the radial or carotid artery. To measure radial pulse, use the tips of the first 3 fingers, press firmly, but gently, on the radial artery, compressing over the styloid process of radial bone. It is advised to count the pulse for an entire minute. Pulse is examined under following headings: rate, rhythm, volume, character, vessel wall condition, delay, and peripheral pulses. Pulse rate. In normal healthy adults, the pulse rate is between 60 to 100 beats per minute. A pulse, less than 60 beats per minute, is known as bradycardia, and is seen in healthy athletic individuals, atrioventricular block, medications, and sick sinus syndrome. A pulse, of greater than 100 beats per minute, is known as tachycardia, and is seen in anxiety, supraventricular tachycardia, hypovolemia, and hyperthyroidism. Pulse rhythm. Pulse rhythm is normally regular. Sinus arrhythmia is normal variation of pulse rate with respiration. Irregular rhythm can be further categorized as regularly irregular and irregularly irregular. Regularly irregular rhythm is noted in paroxysmal atrial tachycardia with fixed AV block, ventricular bigeminy or trigeminy, and atrial flutter. Irregularly irregular rhythm is noted in atrial fibrillation, paroxysmal atrial tachycardia, with varying degree of block. Pulse deficit. The pulse deficit is the difference between heartbeats and pulsations at the periphery and is determined by simultaneous palpation at the radial artery and auscultation of the heart apex. More detail to follow in the upcoming videos. Pulse volume. Pulse volume is best assessed by palpating the carotid artery. The degree of expansion displayed by the artery during the diastolic and systolic state is called volume. A weak pulse signifies narrow pulse pressure, caused due to low cardiac output and hypovolemia. A bounding pulse signifies high pulse pressure. It is due to low peripheral resistance, increased cardiac output, and increased stroke volume. Pulse character. Pulse character is defined by the waveform of the pulse. It should be evaluated at the carotid artery. The waveform can be separated into an anacrotic and dicrotic limbs. The normal pulse character is also called catacrotic. More details to follow in the upcoming videos. Condition of vessel wall. Determine the condition of the vessel wall by rolling the artery under the fingers. Normal vessel wall is elastic and non-palpable. Cord-like thickened vessel wall is abnormal and is noted in atherosclerosis. Radio-radial delay. To assess for radio-radial delay, palpate both radial pulses together. In healthy individuals, the pulses should occur at the same time. If non-synchronous, it is indicative of obstruction to the arterial tree, atherosclerosis, thromboembolism, and aortic dissection. Radiofemoral delay. Palpate the radial and femoral pulses of the same side at the same time. In case of delay, the femoral pulse will be slightly later than the radial pulse. Significant delay suggests aortic coarctation distal to the left subclavian artery. Peripheral pulses. Assessment of pulse is incomplete without recording other peripheral pulses. They are used to identify conditions such as thrombosis, Takayasu arteritis, vasospasm, and emboli. Peripheral pulses can be measured at these sites, as shown in the presentation. They are symmetrically palpable, with normal volume. Abnormalities, such as reduced, absent, or aneurysmal pulse, is noted. Pulse findings are presented as rate of 72 beats per minute palpated, on the left radial artery, regular, normal in volume and character, vessel wall not palpable, No radial or radiofemoral delay. Peripheral pulses are bilaterally symmetrical, palpable, and are normal. To get more such high-yield medical content, don't forget to subscribe. BasidiaMED. The easiest and fastest way to take advanced clinical history.